Seguimos com o placar O Papel da Indústria. Chamo ao palco para ser o nosso moderador Lorenzo Santini, vice-presidente da Bausch & Lomb. Seguem-se os nossos oradores. Roger Lopes, da International Surgical President da Alcon. Xavier Aracil, Commercial Director Europe and Canada da Abvai. Mark Cortels, Head of Sales EMEA Ophthalmology da Zeiss.
So, good afternoon to everyone. It is with great pleasure that I present our first international panel at Oftalgest. And I must confess, the first time I visualized this panel, I thought to myself, well, this one is going to be tough to get. But here we are in Viana do Castelo, in Portugal, and in front of us are some of the highest representatives of some of the major companies that work ophthalmology in the world. And I must confess, it feels amazing. It was pretty clear to us that if we wanted to gather all these stakeholders of the healthcare system, we had to have represented the medical industry because they play a huge role in healthcare activity and healthcare evolution. So these are the companies that bring innovation, that bring technology, that bring the medicine, that allow us to treat better our patients and to treat more patients. So if you want to talk about quality and about efficiency and better results or sustainability, these companies should be involved. So once again, thank you so much for coming from other countries, from other continents. It really means a lot to us, and I hope you can enjoy your stay here at Oftalgest as much as I know we will. I'll start with the presentation. With us are Lorenzo Santini, Vice President of Bausch & Lomb, Roger Lopes, International Surgical President from Alcon, Javier Aracil, Area Commercial Director from Europe and Canada, and Mark Cortels, Head of Sales of EMEA from Zeiss. Well, let's begin. Lorenzo, I'll start with you. Healthcare systems are constantly evolving. And how do you see healthcare systems 10 years from now? And what part do you think medical industry can play in that process? If you can get us another mic. Okay.
Thank you. So first of all, you look at healthcare in general, and you look at what are the drivers of change. You got to look at it both pre-COVID and post-COVID. Pre-COVID, the dynamics of healthcare, of the aging population, as well as the increasing costs and efficiencies associated with healthcare have always been present. Those are the major drivers that face politicians, doctors, industry, of how we address that. Then you look at, post-COVID, what has happened, the recovery after the pandemic. You got those influencers that are driving change, but you also have now this transformational aspect because pandemic has taught us different things and have accelerated different things in terms of what's happening, of how we approach medicine in general. Case in point, during 2021, the emergence of development of telemedicine and virtual healthcare took up. Right now you can actually book an appointment with your general practitioner and have an appointment with him or her virtual wherever you are. I had a doctor's appointment in April when I was in Frankfurt attending a congress, and it was pretty amazing. So this whole tendency of virtual healthcare is developing rapidly. What we also see now is artificial intelligence and machine intelligence. The big topic about how data and how information is shaping and helping doctors predict and suggest personalized healthcare. They were suggested in 2021, about $14 billion was spent in that category. And they anticipate by 2027, about like $150 billion will be spent in that category to really provide meaningful information, predictable patterns for doctors who ultimately make a decision in that area. The other thing too, when you look at just healthcare in general, is just how we are approaching healthcare as an ecosystem. I believe that we look at this hospital traditional model and the private segment That's going to continue to evolve, and that ecosystem is going to also require technologies and approaches of how we do that. When I think about how industry enables that and supports those areas or those drivers, ultimately I would say that our role is always to enhance patient care. That's what drives us as a company. We bring technologies to help patient care, and that will be core. And we also look at making sure that the technologies we bring to the market enhances the quality, but also at the same time making sure that the patient cost to the system declines. You don't want the patient coming back. So, driving patient quality will always be core to what we do, and looking at how technology advances AI and MI, machine intelligence, will always be core to our new innovation of diagnostics and machines.
Thank you. You were talking about innovation. Javier, we all know that one of the key trends of healthcare evolution is innovation. But we also know that innovation comes at a cost. How do you think we can promote access to innovation, having in mind that sustainability is also a priority?
Yeah, thank you. Very good question, actually. We've been talking a little bit today about increasing the quality of service, right? And innovation is part of this. I think we as industry leaders have the responsibility to bring new products and services to you. And I think you guys, as an advanced healthcare system, have the responsibility to find a way to adopt this innovation, right? And you're right, it comes with a cost, right? At Alcon, we have about 1,700 scientists exclusively dedicated to create new products for you to use for patients, right? Is a massive investment. Is an investment in the ballpark of 7 to 9% of our revenues. It's just shy of $1 billion. So if we provide products that have a proven data in terms of better patient outcomes or helping you to be more efficient in the healthcare system. Efficiency in the sense of increase the output, for example, number of surgeries, for example, or avoiding secondary costs. A secondary cost could be, for example, a YAG treatment after a PCO, post-capsular opacification, right? If we have products that avoid that, that's saving money for the system. Efficiency could be helping you to manage data in a much convenient way, easier way, avoid mistakes with an integrated patient flow, data patient flow. So if we are able to provide that, which is not easy, and it costs a lot of effort and money, I think the healthcare system should find a way, because it's profitable, to reward that innovation. If what we bring to the market does not bring value to the healthcare system and are purely me-too products, then it shouldn't be rewarded with higher price. That's the way I look at it. And to close on sustainability, we are working very actively in this area. I think there is a big opportunity to improve on our side, on the industry side, and provide you products that pollute less the environment. We face always the challenge between single-use, which single-use actually fosters medical safety, right? And reusability. I think single-use is here to stay, and it generates waste. But on the packaging side, in medical devices particularly, there is a big, big opportunity. Reducing packaging, less bulky packaging, less plastic, is an area where we are very actively working.
Thank you. Javier, we all know the limitations of healthcare systems regarding human resources and financial resources. How do you think ophthalmology services and healthcare in general can manage this rising pressure over their capacity?
Thank you. That's a great question. But before answering it, please let me thank you for inviting us to this kind of events. I think that one of the most important things to address the challenges that we're going to have in the future is to bring together all the different stakeholders that are working in the pharmaceutical environment and in the healthcare system. So on behalf of all my colleagues, I think that thanks to you for inviting us. Now let's go back to the question. So the access, the capacity management. I mean, I think that the biggest issue that we're going to have, apart from what has been said by my colleagues, is going to be for the patients, the access to care. And this is based on three elements that we are currently facing. The first one is, and it affects particularly ophthalmology, is the aging of the population. We know that the majority of the ophthalmologic conditions are going to grow in the next 20 years, just by the fact that the population is going to be older. The second one is the difficulty, and particularly in Portugal, you have been talking about it, the difficulty to attract professionals to the public sector. So it's something that obviously is going to have also an impact. I mean, there's going to be a debate also with the private sector, as you discussed in the previous panel. And the third one is mainly due to the fact that we're gonna have, the last one is going to be due to the model that we have. So the external consultations is the way that the patients are being referred to the ophthalmology services. And this is obviously something that has to be addressed. Solutions to that are very easy to discuss, very difficult to implement. So one that we think is quite important is to try to support more primary care services in ophthalmology in order to do a triage of the more complex and more severe conditions, to optimize the efficiency on the referral pathways to the hospitals. The second one, to tackle the lack of HCPs or the lack of doctors on the public setting. You're going to have the discussion with the private sector, and it's something that it will evolve. And for the third one, which is the aging of the population, I mean, we cannot do a lot. But what we do as a company in AVI is that obviously we work on delivering products that are safe and efficient, but also we are prioritizing those products that reduce the number of injections, that reduce the number of visits, that maximize the efficacy and the efficiency of patients' time, but also of HCP time. And on top of that, one thing that I would like to bring also to the discussion is one initiative that our Portuguese colleagues here has been working on, which is a tool, an added value services that supports the management of the appointments and the management of the products in order to maximize the time. And it's an initiative that it's currently running in Portugal. It's called the DEX tool, and it has been also exported to other countries across Europe.
Thank you, Javier. Mark, our healthcare systems are changing, and so are our patients. How do you see our digital patients from nowadays?
Yeah, thanks for the question. Yeah, digital patients may sound a bit strange, but I would say patients are also customers. And I think we have seen already pre-COVID, but accelerated post-COVID, the way that customers look for information and the way that customers look for services and products. And I see this also happening in healthcare, not specifically only in ophthalmology, but in healthcare in general. I think there is a generation of customers coming, and there is an aging population, I fully agree, but there is also a group of younger patients that seek all their information online, I would say. So, and this is really changing the way that our potential customers, your potential patients, will look and also will be prepared when they come into the hospital. So the time is gone that you go to the hospital and there you get your first information. I see my own kids looking for information for everything they want to buy. They are first looking for that and then they make an appointment. So I think that's a task for us, industry, for our customers, but also I would say for clinics and hospitals to make sure that we create the right platforms for those patients looking for information. Not just a website, but I think we already talked about it, making an appointment online, having maybe a preparation video chat with your doctor. So quite some new things we need to make sure that are there for, I would say, the new generation of potential patients that is coming to us.
Thank you, Mark. Let's focus a little bit on ophthalmology now, and back to you, Lorenzo. Can you please pass the mic, please? Ophthalmology is one of those fields where everything happens really fast. How do you see ophthalmology practice 10 years from now?
You know, I think it's a most important question relevant to the audience here as well. You know, I think when you look at ophthalmology and you look backwards and see what's happened over time, the best analogy I can give you is think about a pendulum, you know. And I remember at a point in time of healthcare where the ophthalmologist had a lot of control of choices of technology, the application of how they ran ophthalmology in the hospital, and they made the right choices for their patients, for their hospitals. And that was a point in time where, again, you know, it was very doctor-driven. And then we saw the pendulum swing to the opposite side, where we saw the engagement of administration. We saw politicians and administrations take control of medicine, and ophthalmology specifically, where, you know, the intent there was just to drive efficiency. And that really drove a different flavor to an approach to medicine, and specifically ophthalmology. And the control of decision-making was shifting very quickly. When I think about ophthalmology in general, or healthcare in general, it's very important that the pendulum shifts to the middle. You know, the voice of the ophthalmologist at the table, driving the right decisions, whether in the public system or the private system, has to be core. And you got to balance it also with the mindset of administration, the politicians of what their agenda is. You know, obviously they want cheaper, faster, better. And the ophthalmologist wants the best outcome for their patient. And we got to find that right balance between the two muscles. You can't swing either way because it's not going to solve the problem. So it's very, very important that we move in that direction. Secondly, I would say when it comes to just general ophthalmology, you know, our colleagues talked about what's happening in the marketplace. What's interesting is going to be, you're going to have, over the next 10 years, a lot of patients walking into the ophthalmologist's office asking them specifically the technology that they want. You know, the driver of adoption in the past was the physician. Now that there's going to be a power shift because the media and digital information is so rapidly available, there's going to be a significant move towards patient activations. You know, there's a lot of people out there with cell phones going out there knowing what's out there, and they're going to ask questions to physicians. So when specialty products are coming out and the patient has the ability to pay and inquire, the ophthalmologist is going to have to be ready to respond to these new innovations that are coming to market. So patient-driven technology is going to be the new world that ophthalmology is going to face, because industry is going to be pushing new innovation to the marketplace, because, again, the thing that drives us every day is patient outcomes, quality of life. That's what we push all the time. So looking at how information and patient-driven technology is going to drive ophthalmologists to be very comfortable or uncomfortable with new innovation is going to be very, very key. The other thing, too, I would say is, again, when you look at this ecosystem of public versus private, both areas must exist. The public system is core when it comes to residency, chronic care, difficult cases, and you know, that's where great medicine, great studies are actually published. You know, the public system, the private system enables efficiency, but we got over the next 10 years, the ecosystem needs to be really established and sound, because we got to make sure that those foundations of what drives you know, the optimal healthcare outcome is maintained. And I do think those two pillars coexist. You cannot see it swing too much to one way, because it's not sustainable. But to find that right control, that right mechanism mix of public versus private is something that every market needs to do. In Portugal, approximately 30% of the volume of cataract procedures are done in the private segment, and 70% is in the public, which is a pretty interesting mix, and probably the private's growing a little more aggressively, but it's very important that we maintain those two pillars and that we continue to evolve their roles as we go forward.
Thank you, Maurice. Javier, in your opinion, which are the next big steps in ophthalmology evolution in the near future?
In the near future. Let me say, though, what Lorenzo said, I absolutely agree. I think you nail it. It's interesting to see how, I guess, the balance is the right approach, both in terms of doctor opinion versus procurement opinion, right? And the other one, public working in collaboration with private, right? Cannot go one way or the other, too extreme. And we've seen those swings in some markets, and I think they will self-correct on their own at a certain point. Not Portugal, other markets in Europe. To answer your question, look, during and just after COVID, we've seen a significant increase of the adoption of multifocal implants, multifocal or EDOF implants. And we think this is going to continue significantly and is going to actually reach a very respectable level. Here in Portugal, you are pretty advanced compared to other markets where you allow, my understanding, you allow certain percentage of multifocal implants in the public setting, limited percentage, while other markets do not actually accept that at all, right? So I think multifocal uptake is an important area. The other area is about connectivity, is about workflow, patient data management in a seamless way, integrating the clinic, the pre-op, with the surgical planning, with the operation and the post-op. And understanding the outcomes better than we understand them today, measuring the outcomes better, so we can correct certain steps through the whole journey. That's what we see coming very strongly, and most of us are working in this direction.
Okay. Javier, do you think there's a place for individualized medicine in ophthalmology, and how?
Great question again. I think there is a place for individualized treatments in ophthalmology. I think that when we talk about individualized treatments, it's very simple. It's the right treatment for the right patient at the right time. And this is something that obviously all the different therapeutic areas are trying to achieve, and it's something that in ophthalmology we should achieve. I mean, we are investing heavily in data convergence, real-world evidence, precision medicine, also in several other data sets in order to gain access to all the information that can help everyone to treat the right patient at the right time. And I think that we are entering into an era right now with all the artificial intelligence boom that we are currently, I'm going to say facing, because it has also some challenges, but if it's used properly, is definitely something that will help our patients move from one size fits all to receive the right treatment. Because I think that if we took the example of retina, where it's very much driven by the images that you take in an OCT scan or whatever, with the artificial intelligence algorithms, we can support in 5 dimensions, I would say. The first one is early detection. You're going to be able to identify earlier those patients that will require a treatment before it's really too late. And this is part of individualized treatment, treating at the right time. The other one is individualizing the treatment per se. With artificial intelligence algorithm, you can analyze different amounts of images in order to find the right spots that could help you take decisions on your clinical practice. Thirdly, it will help you in your efficiency, because it's going to be much faster and less costly to do it with artificial intelligence algorithms. The fourth one is about the importance of remote monitoring. We're talking about the capacity issue and different problems that we have with the access to care. One thing that will happen surely in the next 5 to 10 years is that the remote monitoring will help us to alleviate a little bit the pressure that we have in the tertiary hospitals. So with all of this in mind, I think that what we want to say is that we are actively supporting all these kind of technologies, because we definitely think that it will help not only the national health system, but most importantly, the patient outcomes that we want to achieve.
Thank you so much. Mark, we're starting to hear talking about private equity in ophthalmology. In your opinion, is this an issue?
I would not call it an issue. I think it's a fact. It's a fact in healthcare in general. It's not only in ophthalmology. I think we see also in other specialties like dental and other this consolidation and this private equity, for the obvious reasons, stepping into this world. Moving into ophthalmology, this is going very fast. If I look at least EMEA, there are countries that are so consolidated that I would say half of the business is in the hands of 2-3 groups. Is this good? Is this not good? That's not something that I will point out here, but it's a very strong trend and effect that this is happening in Europe, and it's already happened in the US before. Our role as industry is to work together with those groups. Of course, they are so important, so we really need to see what they want. One of the things that I see a lot as a request from this group is efficiency, workflow efficiency. We were already referring to it also. But like Lorenzo was saying, we have to keep the balance, of course, also, because we were talking about balance, public and private. And again, in some countries, I would say the pendulum is a little bit too far in that direction. But I just want to point out this is a trend that will not go away. Again, this is very fast. Every week we hear about clinics being bought by these groups. But our role is, of course, to cooperate with those groups. And I think on the other hand, you have the role of the healthcare professionals, the clinics that have been bought. Also, there are advantages also. You have access to the latest technology, maybe a bit faster in those groups. You have this buying power, I would say. So there are also some advantages being part of that group. So that's the way I see a bit this landscape changing. Where will it end? I don't know. I know that in Germany, for instance, there is now a law coming up that private equity will be limited in the number of clinics they will buy, as an example. So there is already some, I would call it, some counter arguments coming up, and some laws that are being built, for instance, in Germany.
Do you think there are any consequences for our patients?
Well, that should not be the case. I think the quality of care is the number one thing to do. And the doctors, they stay the doctors, and the industry stays the industry. The only thing is that on this efficiency pressure, that's something which I feel a lot with these groups. I'm personally a lot involved in talking to those groups. What they really want is to do more surgeries in a day than they did before, as an example. So will this automatically decrease the quality of care? I would say no. I think it's their task to keep that quality.
Okay. So we're good on time. You've made my job easy. I'll ask you a final round. If you could, in a few words, tell us about your company's vision or your company's plans or strategy for the next 10 years. That is, of course, if you can share them with us. Lorenzo.
Well, first of all, again, thank you for having us. I think, as they say, the human progress starts off with great questions. So you're asking some great questions. So hopefully there's progress out of this. Bausch & Lomb has gone through a lot of changes. It's a company that's been around for 170 years, and we're evolving. And we now have a new CEO on board who's with us since he was with us in 2010, and now he's back, Brent Saunders. So we're quite excited about the new future of Bausch & Lomb, being a separate public company and now finding our way, being very focused in what we do in terms of vision care. So we're really quite excited of participating and move the agenda forward with our colleagues of driving new innovation for patients. We believe that that is an area that we're all focused on, and we want to do it collectively for the best outcome for our patients. So, I think about, again, you got a very focused approach for Bausch & Lomb. Before it was kind of a little more diluted in Bausch Health, but now you got, I would say, a dedicated company with a clear plan on making sure we drive innovation in the 4 major categories that we play in as a company, not only in surgical, in contact lenses, in pharma, and OTC. In the surgical space, we're going to definitely see innovations committed into the categories of refractive, glaucoma, anterior and posterior. It's an area that we're committed to make sure we bring innovation to the market as quickly and efficiently as possible. So I'm quite excited about our future. I'm quite excited about our new leadership that we have on board. And, I think the industry collectively is bringing new products, new innovation to most importantly, deliver quality of care and more visual outcomes for our patients. And I also believe that the cost of the patient is declining, and we're going to have a more productive population as a result of the innovations coming to market.
Thank you. Javier?
Same question?
Same question for all of you.
So if I have to summarize in a couple of big blocks what we're trying to do in the next few years, one area is to make a step change on advanced technology lenses. So we're working, for example, on accommodative IOLs, intraocular lenses that can change the shape inside the eye to accommodate. That's one area we are very active. Or tunable IOLs, lenses that once implanted, once in the eye, you can actually affect the power of that lens and fine-tune if there is any small refractive error and be corrected. So this is an area, this is one axis. The other axis would be on the equipment. And we are talking about the next generation. So next generation of phacoemulsification, what is it going to be? I think we have a pretty clear idea where we're going with that. Next generation of retina systems. So we are very advanced in that area as well. Next generation of refractive suite. How are we going to be doing refractive surgery during the next 7 or 8 years? And as Lorenzo said, we believe glaucoma, surgical glaucoma is an area with a lot of potential, an area that needs to evolve significantly. Besides surgical, we have our contact lens and dry eye business as well, which is also bringing innovation in a very fast pace. So this is where, let's say, high level we are working on.
Okay.
Thank you.
Thank you. Javier?
Thank you. So for us, support patient vision is our mission. And this is what is going to drive our strategy in the next 5 to 10 years. I think that we have a very strong legacy coming from Allergan, and now since the integration with AbbVie, the support and the focus in eye care, it has been multiplied by 10, I would say. We are in a company that is very focused on driving innovation and first-in-class products. The clear example of that is the amount of money that we put on R&D. I mean, since the inception of AbbVie, we have been investing more than $50 billion in R&D trials, not only in eye care, in the 4 different areas that we have in AbbVie, but obviously eye care now is one of the 4 key pillars that we have in our company. if we look at the areas that we're going to be focusing in the future, it goes from, I mean, the good thing is that we're going to cover different areas. It goes for the very common conditions like dry eye, in which we continue bringing innovation into this area, to the areas where we have been very strong in the past and where we try to be even stronger in the future, like glaucoma, not only pharmacological but also surgical. And we have in our pipeline very promising products for wet AMD and for diabetic retinopathy.
Thank you so much. Mark, same question.
Yeah, thank you. Yeah, I want to talk about two things. First of all, what we have been doing for also more than 170 years is bringing innovative products to the market. I think, and I'm talking about Zeiss in a whole, but also, of course, Zeiss Ophthalmology. And we will keep on doing that. We are keeping investing in R&D and bringing devices on the market. One example is that we finally also stepped in the phaco market, launching a new phaco machine also. So we are keeping bringing those products. But another one, what I think is at least even important, is what we call connectivity and data management. We have, of course, with Zeiss, a huge installed base of diagnostic equipment and surgical equipment. We can connect them. They are connectable already today. And we are now rolling out a cloud-based solution together with Microsoft where all the data can be consolidated. And finally, and that's our objective, we want to use those data in bringing applications to our customers. An example is a surgical planner. Another example is we have launched a surgery optimizer where we can compare different surgeries by using artificial intelligence. So also AI on our OCTs is available. So it's a lot about data and what can we do with all those millions of images that are every day taken by all the devices, not only ours, also other devices. So I would say keep on doing what we are doing, but this extra layer of what can we do with all those data, that's the next step for us.
Well, thank you so much. I mean, talking about efficiency, great answers in a very short time. Thank you. I think it gives it a little space for any questions from the audience. If anyone has a question. Well, yeah, I think you answered all of them. Thank you so much for coming. It was an honor. Hope you enjoyed it, and hope to see you soon. Thank you so much for coming.